The Shift is brought to you by SE Healthcare. Welcome to The Shift. I'm Dr. Andrea Coyle. Welcome back to the next episode of The Shift. This is the month of nurses. And what better way to recognize nurses than to bring on Daisy honorees to talk about meaningful recognition and how Daisy has really shifted the narrative of nursing, and it's also elevated the profession of nursing. And I'm really proud today to introduce someone that I've just recently met who is incredibly lovely, Liz Cumpian, a fellow Daisy honoree. Liz, welcome to the podcast.
Thank you. Thank you for having me.
It's our pleasure here at The Shift. And so we're going to start off. I know you're a Daisy honoree. Tell the Shifties a little bit about just quickly what your role is right now in nursing, and then how you got involved with the Daisy Foundation.
So I am a perioperative nurse navigator for surgical services at Northwestern Memorial. We have a large surgical department. And so my role is anything that touches a patient or family throughout the course of surgery, I can get my hands on, along with assisting anybody who is in the surgical services area to help them make the patient experience better for the patient. So,
Liz, when you first told me, when we first met and you told me about your role, I think it sounds like it's a pretty innovative, unique role.
Oh yeah. And some people, it's very funny because people are like, oh, I would hate to have your job because a lot of times you're dealing with people who are upset. But I honestly love my job. I love to come to work every day. And even though I'm not at the bedside in PACU any longer doing bedside nursing, each and every day I still get to come to work and make a difference in somebody's life.
And I love that you say that, Liz, because isn't that really why we got into healthcare, is to make a difference in the lives we touch? I say that every day. I'm no longer in the care delivery environment, but I'm very crystal clear on my purpose and my assignment, and it is to make a difference. And even when you and I have this conversation and the Shifties hear our discussion, we're going to make a difference. Today, we're going to make a difference in 25, 30 minutes. So it's incredible.
Yes. Yes. And that's the thing I say, people, you sometimes hear about how much people make in business, and it's like, yes, but I go to work every day and I make a difference in somebody's life.
Not a dollar. We make a difference, not a dollar.
Exactly. Oh, that's so good. I'm going to start. Yeah.
I just honestly came up with that, Liz. That's how fun this is.
Right there.
Make a difference, not a dollar. I love it. So tell me about the first time you learned. We had this discussion. We were talking about this earlier. You were on the Daisy committee.
Yes.
And then you became an honoree. So tell the Shifties a little bit about your Daisy journey.
Okay. So when Northwestern decided they were going to bring the Daisy committee, the Daisy program here, I volunteered to be on the committee. So I basically collect all the all the nominations from surgical services. I scan them in every month, and then I forward who should, be eligible to get the Daisy Award for the month, because, we get a lot of people write, oh, I had a great nurse. She was really wonderful. But it's something when somebody goes above and beyond the extraordinary care that somebody gave. And those are the ones that get forwarded from all of us, because we have a huge hospital. From all of us who collect, they get forwarded to another committee, and that committee picks who wins for the month. So when I got my Daisy Award, my coworker nominated me, which is also the great thing, is that it doesn't just have to come from patients. It can be from your coworkers. So my coworker nominated me because there was a patient in surgical services who was scheduled the second case of the day, and their insurance hadn't been approved yet. And they were so upset and so stressed out. And I said, this doesn't really fall under my, job description, but surgical services, I can do anything I want to make it a better experience. I talked to the surgeon, I talked to the anesthesia coordinator, and I said, can we switch the schedule order? Let's do the next patient. Give me some time. All day long, I worked on this, trying to get this insurance approved, calling different people. And we were able to have this patient have surgery that day. decreased her stress about not being able to have her surgery done. Her family had taken time off, so they didn't have to worry about that. She was done the last case of the day, and all throughout the day, I just kept in contact with her because I was working, 10 feet away trying to get this hammered out. And it just was really a great thing to be able to do that for the patient. And I had no idea that my coworker even nominated me.
That's awesome. I have a quick question, Liz.
Yeah.
Does Northwestern have, so the organization, when I became a Daisy nurse honoree, a nurse leader honoree, we have the leader award, the nurse award, the team award. We have a Daisy Garden. The College of Nursing that's affiliated with us has the student Daisy. What does Northwestern have?
We pretty much just have the Daisy Award. But it's that alone is impressive.
It's incredibly impressive. And so what I say when I would go speak and do my RISE presentation, which is Reignite, Inspire, Support, Empower, I often challenge organizations to bring the leader and the team. Are you guys a magnet hospital?
Yes.
Yeah. So, that might be something that you guys could consider moving forward.
Right.
That recognizing nurse leaders is so powerful, and the team, because it takes the team.
Oh my gosh. And I have to tell you, I'm going to give a shout out now to our nurse leader, Kristen Ramsey, who is amazing. I was fortunate enough. She was the vice president of surgical services years ago. So she and I got to know each other in that role. And I've just been able to maintain contact with her. I have her cell phone number, and she will give that out to anybody. She's so approachable. Prior to this, I've been here 23 years, but I've never in my career, I've been a nurse for 38 years. Never could I just walk to the chief nurse executive's office and say, do you have a minute? When my father died, she reached out to me. One time I was crossing over the bridge with her. Whenever I see her alone and I can get a minute with her, I take it, and I was talking to her about mission work because I go on a mission trip twice a year. And I said, could we please have it that we could take, time off for mission trips without having to use our PTO? And this was in the spring, and I was going in the fall, and I called her, like in September, and said, I'm going to Nepal in November. Would it be possible to take it without PTO? And she said, you know what? Let me get back to you. She got back to me. She said, we're going to use you as a pilot. Don't tell anybody. It's just, between you and I. And then in January, I called because I was going in March, and I said, I called in December. Anything going on with that? Was it approved? And she said, yes, that's going to be part of our, HR, one of our benefits now. So at Northwestern, you can take up to 30 days a year to do mission work, and you don't have to use your PTO, which for me is great because my family is all out of town. I want to save my PTO to be able to go visit my family, but still do my mission work. So that's Kristen Ramsey for you. I'd give her a Daisy Leader Award and a New York second.
Oh my gosh, that is awesome. That is great. That really speaks to people first, human-centered leadership.
Yes.
And I love that you shared that with the Shifties. So let's talk about that. So the whole Daisy is evolving. You were on the Daisy committee. You knew about Daisy. You have the Daisy Award. And then Tina shared with me, she introduced us, that you are a mission grant recipient from the Daisy Foundation. So can you share that with the Shifties? Talk about the benefit.
Yes. 2 times I've been awarded a mission grant, which I'm so grateful. So I do mission work for Operation Walk Chicago. I'm the director of nursing, and my role started just as, a nurse who applied. And then it's over the years I've, progressed, and I'm over nursing now, which is great because the thing is I get to go on every trip. I don't have to worry about getting picked. I get to pick. So, but with that, Operation Walk Chicago makes it affordable because that's the thing. People want to volunteer and they want to do mission trips. But a lot of times, there's a hefty price tag to go along with that. And when this came into my life, I Operation Walk was affordable. Other mission trips weren't because I had two young children that my husband and I were educating. How expensive it is to raise children. So the great thing is, though, with the mission trip for the Daisy too, it's up to $1,500. You let them, you talk about your mission, you apply, and then they get back to you and they let you know if you want or not. But to not have to worry about paying for your trip is such a gift. And also, it's such a great thing that when you win this award, you get the beautiful sculpture, as you know,
Ah,
your pin, but then you also get all these benefits that go along with it. So people who have won the Daisy Award, I highly encourage you to make sure you go onto the website and look to see what is available to you as a Daisy Award winner.
oh my gosh. I'm so glad you said that because that's actually part of what we're doing this month for Nurse of the Month is reminding everyone that there are so many benefits to being a Daisy honoree.
Yes.
But truly, there are also benefits, and I encourage people, there are benefits to writing down and nominating someone for the Daisy. I've nominated multiple people in my career, and it just feels really good, and it releases a lot of healthy hormones.
Yes.
So, not to get too scientific, but it's a great feeling. Have you ever nominated anyone, Liz?
I have not, but well, I in a backwards way because since I get all the nominations,
Mm-hmm.
then I
Yeah,
get those forward.
right.
You
So
know,
I
but
remember.
I'm sorry, excuse me. Um, in my role, I come in contact with so many people. If I see that a nurse has gone above and beyond too to a patient, I'm like, do you know about the Daisy Award?
I was going to ask you that because I was an interim nurse manager while I was a professional excellence and magnet program director. So I was wearing two hats. One of my favorite things to do was to round on the patients.
Yes,
They would give you so much information. And when they would start to tell me, Nurse Ashley or Nurse David did a really great job, I said, well, did you know about the Daisy Award? And some would say, yes, they saw it on the Get Well Network or they saw it somewhere. And I would sometimes sit down with them and help them write a Daisy nomination.
yes,
And I love that part of my job.
right. I had a patient, it was a gift of hope situation, and the family wanted to nominate somebody. They were talking about how everybody had been so good to them in this unit. And then I gave them my information and I told them about the Daisy Award. And I've just waited. And just the other day, I got a letter from the patient's brother who said in his letter, this took me a long time to be able to get to this point. But, a beautiful letter that he wrote. And then I'll be able to pass that on to the Daisy Award. Because I thought if I give them a nomination, chances are they're going to lose it with everything they're going through. So
Right.
that's why I sent him an email so he could have my email. And that way I knew that when the time was ready for him, I would get a letter and then I can pass it on. And it's like, oh my gosh, and also that's perfect. I am going to, reach out to their manager and the Daisy Foundation as well, because they honestly, that whole unit, they were so grateful for the care they had received.
That's a great story. So, Liz, as you know, the podcast is called The Shift, and I named it The Shift on purpose, with purpose. And the purpose is to highlight shifts in our mindset, shifts in what we do, how we shift. And I'm just curious, Liz, after you received the grant, what shifted for you?
Um, you know, I always lived my life with gratitude, but it's like even more gratitude for the Daisy Foundation and what they've done for nursing. I mean, honestly, so the year I won, I had a stellar year. I received the Martin Luther King Humanitarian Award from Northwestern in January. The day before,
Congratulations, by the way.
the day before I received the Daisy Award, I received the Distinguished Alumni from St. Xavier University, where I did my, undergrad. And then the next day came to work and received the Daisy Award. And it's like the thing about the Daisy Award is for extraordinary nursing. And it's like so much of who we are in life is we get our identity from our job. And it's like, I'm mother first, and wife goes along with that, but I'm always a nurse second. And I love my job. And so to be honored by the Daisy Foundation, and I just can't say enough about them. I've met them both times when they came to Northwestern. I thought it was important to be here to meet the people who have done so much for nursing. When I was telling the first time I was there and I was telling them, I'm so grateful. Thank you so much for helping me do mission work, because that also is so important to me. And then they asked me if I would be interested in being on the committee to review grants. And I'm like, well, of course I would. And of course, life is so busy. But when I got the email about us doing this, I'm like, and I need to follow up on this. So I'm going to start reviewing grants for the Daisy Foundation. So
that is awesome. So Liz, you and I had a discussion prior to the podcast, and I love what you said. Mark and Bonnie have been to Northwestern twice.
yes.
Right? And tell the Shifties what you told me earlier.
What did I tell you earlier? Right there. It's like
you said you were off of work and you went into work on your day off because it was so important for you to meet Mark and Bonnie. And I think that's amazing. That's to me how the power of the Daisy Award and the Daisy Foundation shifted you in a way that now you want to give back.
yes.
You want to elevate and you want to recognize. So I think that's a shift and I love it.
The thing is too, that day, they weren't able to make it. Last minute, they weren't here, but Melissa was here. So
nice.
Melissa. Mm-hmm. And the next time they came, I was able to meet both of them.
Liz, thank you for sharing all the shifts in your career, especially thank you for your mission work. It's so important and it feeds the soul. It really feeds the soul. And I love that you shared that Northwestern truly supports that, not just for nurses, but for everyone that works at Northwestern. So kudos to the Northwestern leadership team. We typically end each episode with 3 things that we want to share with the Shifties that we believe are important. So if you had a couple things to share, 2 or 3 with the Shifties, what would they be, Liz?
I'd say volunteer. We get so much from volunteering. And like you just said, it feeds the soul. Every day we have the ability to make a difference, like we talked about. And you have to believe in the power of nursing, because we are so fortunate to have this career. In nursing, you have so many opportunities. And for me, it's always been that when when the perfect job wasn't there, it came there. And it's such a great job, a profession to have, single, married, family. You can do it all in nursing and you can find your niche. And it's to me so rewarding. And definitely try and go on a mission trip, because to be able to do nursing and volunteer at the same time is life-changing.
Liz, everything you just said, literally, Deb Zimmerman was the first Shifty to come on the podcast. And really, we talked about shifting the narrative and all the opportunities there are in nursing to make a difference. And you summed them up beautifully. So
thank you.
Thank you so much. And at every episode, at the end, I always say this, Shifties, remember, your shift makes a difference. Keep shifting. During the month of May, Nurses Month, as we like to call it, is a great time to recognize all the accomplishments of nurses, and no one does it better in a meaningful way than the Daisy Foundation. Did you know that the Daisy Award honorees are eligible for many benefits that never expire, including conference grants, reduced tuition, reduced certification fees, and a discounted subscription to SC Healthcare's Nurse Burnout Prevention Program? Visit daisyfoundation.org and search for honoree benefits to learn more and see the complete list. Enjoying the shift? Help us reach more nurse leaders by rating and reviewing us on your podcast app. It takes just a minute, but makes a big impact. Search for The Shift, tap those stars, and share what you love. Your feedback shapes our future episodes and helps others discover us. Remember, rate, review, and amplify The Shift today.